Hey everyone, welcome back to my YouTube channel. I'm Althea, your go-to guide from Sister Althea. Today's video is one you've all been waiting for. The title says it all, NCLEX Myths Busted. What they didn't tell you about the exam. There's so much misinformation out there about the NCLEX, and trust me, some of these myths will have you shook. So in this video, we're breaking it all down, fact versus fiction, so you can walk into that exam confident and ready to crush it. Make sure to watch till the end because I'll be clearing up the biggest misconceptions and giving you the truth that no one else is talking about. So let's get into it. Let's start with the basics. What is the NCLEX? The NCLEX, or National Council Licensure Examination, is the standardized test that every aspiring nurse must pass to get licensed. It's administered by the National Council of State Boards of Nursing, NCSBN, and is designed to assess whether a candidate has the minimum competency required to practice nursing safely and effectively. Whether you're aiming to become a registered nurse, RN, or a licensed practical nurse, LPN, passing the NCLEX is a must. Now let's dive deeper into what this exam is all about. I have other video out there. Please do watch it if you need more info. Moving on to the next. So, the first myth we're busting today is the NCLEX is impossible to pass. Let's set the record straight. The NCLEX is definitely challenging, but it is not impossible. In fact, over 85% of first-time test takers pass the exam. The key to success isn't luck. It's proper preparation, focus, and the right strategy. With a solid study plan and the right mindset, you can absolutely conquer this exam. So don't let the fear take over. Let's talk about how to prepare the right way. Myth 2, I need to know everything to pass. This is a big misconception. The truth is, you don't need to memorize every single detail from nursing school. The NCLEX isn't about regurgitating facts. It's about applying knowledge in real-world scenarios. Instead of trying to cram everything, focus on core concepts, prioritization, and critical thinking. Understanding how to think like a nurse is what will get you through this exam, not just memorization. Work smarter, not harder. For myth 3, if I don't finish the exam, I fail. This is completely false. The NCLEX is computer adaptive, which means it doesn't require you to answer every single question. The exam will automatically stop once it has collected enough data to determine whether you pass or fail. Some test takers pass in as few as 75 questions, while others go up to the maximum. But either way, not finishing the exam does not mean you failed. It's all about how well you answer the questions you do get. Myth 4, you have to study for years to pass. Nope, you don't need years of studying to pass the NCLEX. With a focused, structured study plan, a few dedicated months of review are enough. Instead of endless cramming, use targeted study materials, practice tests, and a consistent study schedule. Success comes from quality over quantity. So work smarter, stay consistent, and you'll be more than ready to pass. Myth 5, you must use only expensive NCLEX review courses. This is totally false. You don't have to spend thousands of dollars to pass the NCLEX. There are plenty of affordable or even free prep resources available. From free online practice exams, YouTube tutorials, study groups, and mobile apps, you can find high-quality study materials without breaking the bank. The key is how you study, not how much you spend. So take advantage of the many budget-friendly resources out there and study smart. Myth 6, NCLEX is all about memorization. Wrong. The NCLEX isn't just about memorizing facts. It's about how well you can think like a nurse. The exam focuses on clinical decision-making, prioritization, and real-world application. Instead of cramming, practice critical thinking and learn how to apply your knowledge in real patient scenarios. The goal isn't just to recall information, it's to prove you can use it effectively in a healthcare setting. Myth 7, you can't take breaks during the exam. False. The NCLEX actually allows scheduled breaks to help you stay fresh and focused. After 2 hours, you'll have an optional break, and you can take another one later if needed. Use these breaks wisely. Stretch, take deep breaths, reset your mind, and shake off any stress. A short break can help you regain focus and boost your performance for the rest of the exam. Myth 8. You have to memorize medications. Not true. You don't need to memorize every single medication. Instead, focus on understanding drug classes, their actions, common side effects, and nursing interventions. The NCLEX tests how well you can apply this knowledge rather than just recalling drug names. Prioritize the most commonly tested medications and know how they affect patient care. That's what really matters. Lastly, I have myth 9. You need to pass with 80 questions. Big, big, big no. The NCLEX doesn't have a fixed pass or fail point at 80 questions. The exam is computer adaptive, meaning it will stop anywhere between 80 to 150 questions based on your performance. Whether you pass in 80, 100, or 145, even 150 questions, it doesn't matter. What matters is demonstrating competency. So don't stress over the number, just focus on answering each question to the best of your ability. All right, we've busted the myths and set the record straight. The NCLEX is tough, but with the right preparation, you can totally pass. Focus on understanding the concepts, practicing regularly, and staying calm. You've got this. Remember, the whole point of the exam is to make sure you're ready to be a safe and effective nurse. And hey, once you pass, you're officially on your way to being a licensed superhero in the healthcare world. Any questions? Now it's your turn. Got any questions? Feel free to drop them in the comments or reach out to me directly. If you know anyone else preparing for the NCLEX, share this video with them. Let's help each other out. And don't forget to subscribe to my channel. It's the best way you can support my work and stay up to date with all the content I'm sharing to help you succeed. Thanks for watching and good luck. You've got this.